Q&A. Start with.
Thank you both. Did we lose our other speaker? Oh, good. Because I'm kind of curious how Anna and Sam might work together, or don't. Because I guess the issue is this: we have so many things going on in this country that don't seem to be connected, and yet there's all this planning about how to move people around, but no consideration of their health, and there's people thinking about how to connect parks to make people healthy, but you're not working together. Explain.
Well, so Anna and I actually have worked together in the past, but you're talking about actually like me and the city planning, the Office of City Planning here in DC, or other people. So I'd say we do work together on a number of levels. So at the comprehensive plan level, what Anna was talking about, that's usually got elements of transportation, of housing, of, I mean, that's a place where people talk about the long-term vision. It should be coordinated. You also,
It should be, or
it should be. You know, most cities, I would say, there's a big role for like a Department of Public Works on the transportation side, and the Department of Public Works is often there to fix the potholes. And most cities aren't making huge capital investments in their transportation system. That's a place where DC, I think, is a little bit different often, but a lot of big cities have created departments of transportation that are thinking differently about it. But it used to be that, or in many cities, it's sort of the Office of Planning that, or the city planning department that is creating the plans, and they might be giving it to the Department of Public Works to build, or it varies there. And then at the project level, there's often a lot of coordination as well. Our Vision Zero initiative actually included 25 different agencies around the city. So it's a place that, safety is a place that a lot of people come together around, and 25 agencies sort of came to the table and said, here's what we can offer. The Department of Motor Vehicles, the Department of Public Works, Department of Health, all were sort of coming together to figure out what could be done from a policy, programmatic, and investment level.
And I'll just add that through our work, we've also seen various models. So when we were doing some case study work on how comprehensive plans were developed to include health, we saw models that included the staff at different agencies reaching out and making friends with one another and coming together around shared goals at the staff level. And we also saw in places like Philadelphia where Mayor Nutter said, I want to make my city healthier, and I want to make it more environmentally sustainable for climate change for the long term, so that leadership came kind of from from the elected official and from the top. But it also was supported by staff having already made friends across agencies, folks who don't cycle in and out every 4 years. You'll also see that in a place like Oklahoma City, which has become well known for the mayor who had their weight loss challenge across the city, and that was supported also through a grant from the CDC. So similar to Plan for Health in our work, we incentivized folks from different departments and different agencies to work with each other and to work with community members to address health. And for some of them that was a new idea, for some of them it was not such a new idea. So it's really a spectrum, I think, across the country of where we're at.
I would just add one more thing, which is often that transportation decisions are not only made at the city level. So most cities, DC is different because we're treated as a state by the federal government for this purpose, not for other purposes. We sort of own every street in the district. Most cities, the interstate is owned by the state. The big roads are often owned by the state or the county or some other entity that is making transportation decisions that are often completely at odds with what the city's vision are, but the city has no say in what that process is. So, that's often a really big struggle that we don't really have to face here in the district, but is something that most cities face on a daily basis.
So I think we have Lee. You had a question or no?
I did.
Okay, so we have Lee, and then Tia, then Andrew, and then Bashara and Elizabeth, and we'll keep going.
Sam, I was struck in your presentation that you mentioned outcomes a lot. Partly the outcomes you're actually getting from changes in what you're doing, partly the outcomes you wish you were getting. In our first presentation today, it was all about process, and outcomes didn't come up a lot. Is that because outcomes are a little bit easier to get in transportation, like traffic fatalities? It's a nice, clear number. Or is there a different culture in the transportation world where you worry more about how what you do relates to what you get?
That's an interesting question, and I missed the first panel. So, well, I guess a couple of things. So one is, I'm a practitioner, so I probably think in outcomes a bit more. I actually try to shift the discussion in transportation away from just outputs, which is where a lot of people in transportation are. How many roads did we pave? How many bridges do we have? What condition are the bridges in? Towards outcomes. Like, if a bridge is falling apart, that's bad. That's a potential outcome of bad safety, so we want to fix that. But I don't really care if we're getting bad outcomes down the line, like how we reconstruct that bridge might be even more important than that we reconstruct it. Let me say it that way. So I think it's a little bit of, my mindset as being somebody who's a practitioner, but I think it also is something in transportation. You generally are trying to justify your existence in some ways by some form of, what are you doing for me? Again, everybody's a transportation user. So everybody is in congestion, or they're crossing a street unsafely, or they're, and everybody's got an idea about how to fix it. And a lot of those ideas are really good.
If I could just add to that from the planning perspective, I think that for planning, a lot of the outcomes have traditionally been around economic benefits, so economic development and resource, more business being attracted to a city, and not necessarily really measuring the impacts at the human scale. So to even start to talk about measuring impacts at the human scale is the beginning of the conversation in a lot of places, and then moving into talking about equity, and then moving into talking about health. So it's, again, a spectrum of where we go with that.
I was struck in seeing, Sam, your slides. I think, was that Anacostia, where there was sort of no engagement from the public about where you were unsafe? It resonated with me. I took a notion a couple of years ago that I would try and be more healthy, and I would bike to work from northern Manhattan to where I work in the Bronx, which takes me right up the Grand Concourse, one of our great avenues. And I've seen the bike lane on the map, and I've seen a number of different planning agencies and city government take great credit for that bike lane. I'm usually the only one in that bike lane, and that is right, because it's a disaster. It's not, you can't actually really see where it's painted in. We share that bike lane with the city buses, who then sort of come in front of you. It's not obvious to me that my health is improved by biking to work in that fashion. So exactly, yeah, it's not really the kind of idyllic, health pastoral experience that one might dream of. So how do we get there? Is this a failure to engage the local community? Is it that people put down a little paint and walk away saying, hey, we made a bike lane? Is it lack of sustaining initiatives? Is it that the people doing the roads are really only interested in the potholes in the pavement and not the mixed use? I mean, what are the barriers to making that a real opportunity? And the last thing I'll say is that the Bronx, where this bike lane is, has the highest rates of asthma in New York City, has the highest rates of obesity. They need the bike lane. So what's up?
I guess yes is the answer to a lot of those questions. New York City has probably one of the more progressive transportation departments in the country as well, and we can all make mistakes. But a lot of this is also sort of incremental. I think there's an incrementalism versus a radical transformation of the transportation system to more healthy outcomes. So I think the evolution of bike infrastructure in the United States started out with sort of there's, I don't know if anybody has heard of the idea of a vehicular cyclist. So the cyclist is like a car, but is a bike. So you're following all the same rules should apply. you're in traffic when you need to be, and if you get 5 feet of painted for you, that's great, and that's enough. I think that's transformed as you start to think about who bikes and who feels comfortable biking. You change your mindset towards things like protected bike lanes and more separation, less stress, and that's a great term. There's a term about low stress bicycling networks. But a lot of those street reallocations also take a lot of time and effort and pain, and maybe cause some pain too. And so, if you've got 5 feet of painted asphalt and you could just steal that from the existing lanes because they were too wide, that's easy. If you're going to take out one of those lanes and put in a bike lane, that may be harder. It may take you a long time. You may get other kinds of opposition from a variety of different places that, when you're still the only person biking on that street, make it easier to attack that as a bad infrastructure choice. So, because you don't have a network. So, and that's one of the biggest challenges here. I mean, we've managed to build out a network, but we still got gaps. And it's the gap that keeps somebody like you or somebody who's even more, biking with their 7-year-old kid or something like that. Like, it's that gap. Who cares if you've got 3 miles of bike lane if that last gap feels unsafe? You're not going to do it. So, we would never tell people you can drive to about 10 minutes from where you need to be, and then it's going to be a gravel road that has big ruts in it. But we do that with bicyclists. We do that with pedestrians all the time. We sort of do that with transit riders because we say we're going to get you there, but like once every half an hour. Right, that's about as good as we can do. So, I think that's probably the best way to answer a lot of those questions. It's not because people wanted you to feel unsafe or wanted you to be unsafe, but there's a lot of things that play into it.
This is Bashar. I have a question for both Sam and Anna, and then a specific question to Anna. As we think about some of the policies and some of the planning processes that you guys have mentioned, I mean, clearly in some of these processes we reach out to communities that have already a lot of these issues. I mean, I live on the north side of Chicago, and within literally a minute or 2 minutes walk from my condo, I get to at least 3 bike sharing stations, 2 train stops, 4 or 5 buses. And I was very active in participating in where we'd like to see those bike sharing stations are. So how do we make sure, as we're thinking about planning processes, we don't make equity even worse for some of our communities? So that's the first question. And then for Anna, to get back to our first theme, from the first session around the private for-profit sector, how active is it with your coalitions across the country?
So on the process piece, I want to go back. So my heat map of where we ask people to tell us where their problems are, that was actually just one strategy that we used in the Vision Zero initiative. So we actually also did like we call them pop-up meetings in sort of in very active pedestrian areas around the city, where we actually reached a lot of people with more generic types of questions. And then when we got into, and we actually had this map available for people there too. So I think one of the challenges is transportation agencies often sort of think about public involvement as like, we'll call a meeting and whoever comes to the meeting gets to say what the outcome is, and that doesn't work either for low-income folks, I have 2 small kids. I wouldn't go to a meeting if I wasn't getting paid to go. It's hard to get participation. So we have to find new avenues of participation, but we have to make sure those aren't, as you said, sort of reinforcing inequitable outcomes as well. So I think it's one of the most challenging things. I generally say that more participation earlier in the process is better, and more at the large scale, regional level almost, which is the hardest thing for people to actually engage with. So it's easy when you start to talk about what's going to happen on your street, and this parking is going to go away on my street because we're going to make a bike lane. Mm-hmm. It's easy to sort of say no to that. It's harder to even comprehend of what the impact would be. It's harder at the comprehensive plan level or at the regional level of what that piece of bike lane might mean in terms of a larger network. So I don't have an answer for you, but I think that is a absolutely important question about how you get to healthy outcomes. So it's sort of at all scales, at all times, and making a more educated general public that sort of feels more bought into this is also important. But it's also part of culture change that's making a healthier transportation system.
When it comes to community outreach and community engagement, I think, yes, absolutely, we need to think of different ways and different tools for doing so, but we also need to think about who's doing that engagement. We need to have people of color. We need to have people speaking different languages. We need to have people that the community can relate to, speaking to them about these really big questions about what the built environment looks like. And part of that is figuring out better terminology and common language to translate our ideas to folks who have a lot of stressors in their lives and a lot of different pulls on their time, so that they see more and more how valuable their input is and that we also actually value their input. I think in the past, a lot of planning and transportation projects checked the box of community engagement and didn't really do meaningful community engagement or meaningfully take into account some of the feedback they got. So I think we have some work to do on our side to make sure that we have folks out there who really can connect with the community. And I think actually we can learn from public health in that regard. I think public health has done some really good work on putting folks out there that residents relate to and can speak to, literally, in the same language. And then when it comes to your second question about engaging the private sector and maybe specifically hospitals or just the private sector in general, businesses?
For-profit, I would say.
For-profit?
I saw a lot of, not-for-profit engagement.
Yeah, I would say that the majority of our coalitions currently do not have a for-profit component in their coalitions. I would have to go back and check to give you a straight answer, but I think that we could do more to engage the for-profit business sector in their work. And part of that is because most of our coalitions aren't working on healthy downtowns. They're working on healthy communities where people live, where they connect to schools, where they maybe how they get out of their neighborhood more, and to bring more services into their neighborhood. So that's potentially one factor of why, but I think that there's a lot of potential for engaging private sector.
Okay, so we have Andrew, Elizabeth, and then Hortensia.
So you've actually, in your responses to this last question, answered part of mine, which is about community engagement. And it's also clear in your presentation that this question of how you, the process by which you get to formulate your priorities, implement certain plans is clearly multi-level, right? And my question was broadly about the role of community engagement, and you've sort of spoken to the who, or some gaps, some issues with the who shows up. And I'm wondering about if you could say a bit more about, and you just said community engagement. If people appreciate how meaningful their input was, how valuable, that might be helpful. Could you say a little bit about, for example, Plan for Health? You talked about these two focus areas, right? Active living and food systems, and then mentioned a number of others that you'd like to see more attention to. Mm-hmm. How would we, so just to take an example, social cohesion, how would we get there? What's the role of community engagement, broadly speaking, in determining what your focus areas are going to be? And how would community engagement affect the degree to which, or the rapidity with which you get to social cohesion, for example, as a focus of your work? Does that make sense?
Yeah, that's a great question. How do we get to social cohesion? I think one way is for us to go to the research and see what kinds of places support social cohesion, and really give a lot of attention to the different kinds of places that can support social cohesion. There's a lot of attention right now to mixed-use developments and shared spaces, public spaces, and those might be great for some people and some populations, but maybe that's not what all populations want to see in their built environment that will support connections among families and friends. So I think there needs to be either a look to the research or more research on what kinds of placemaking can support social cohesion and what kind of living environments support social cohesion. And then the next part of your question was about
Let me ask, but I think my question is more, how would you adopt social cohesion as an area of focus for the work, as opposed to, what it looks like once you've adopted it, right? So why active living and food systems versus these other pieces, and how would you decide what your next area of adoption would be?
I see. So active living and food systems is certainly guidance coming from CDC. And I think in terms of evolving towards a more social cohesion approach, it would be a difference in values, a shift in values, I think, to what kinds of outcomes we want to see, and maybe away from, are people exercising this many minutes per day? What mediating factors are getting towards things that are maybe easier to measure, like minutes of activity or how many fruits and vegetables are they eating, but a more qualitative understanding of health. And I think that would be, it is understood by planners as we begin to shift away from these economic outcomes and more towards people-oriented outcomes. But I think I don't have a straight answer on the best way to evolve to that perspective. I think younger people coming out of planning schools and people as they're thinking about what are the real significant problems in our society are thinking more about social issues in an interconnected way. Bringing the language of health equity to the conversation, I think, is very important because that gets at social cohesion. So I think that's the beginning.
And I just thank you both for your presentations. My question, actually, it was really fascinating because as soon as you started, you were talking about comprehensive planning, which kind of trailed our first one, which made me think about language and the language we use and some of the challenges to doing this cross-sector work. And since you've both been engaged really on reaching across to other partners, specifically health, I'd love to hear some of the lessons learned and thoughts on guidance to do that work effectively.
Okay, so effectively connecting partners across planning and public health. I think we've seen that resources have been a big part of that. When there are grant opportunities for people to advance mutual goals, they somehow find one another to leverage those opportunities and to actually implement their ideas. Also, we've seen, I think, as more and more people are becoming interested in planning and public health when they're in school, they actually get 2 degrees or they take classes in each other's field. And so you have more and more people coming out of graduate school with that perspective kind of ingrained in them from the beginning. I think that's really important. There's more conference sessions and other things like that for when people go to their professional conferences or engage with their local professional groups, they have more exposure to those ideas. I think that's really important. But also what I mentioned earlier with coming down from the mayors of different communities to identify the importance of integrating planning and health, and also looking at ways that we can benefit health in using built environment tools. I think it's having the professionals from both sides find one another, learn more about what one another does, speak more of that common language. Specifically, I think it happens at the project level. We can form cross-agency. I was part of a cross-agency committee when I worked in local government, and a lot of our get-togethers were sort of all of us looking at each other and wondering why we were at the table, and we didn't have a particular initiative. We were just getting to know each other. And so I think having something to grab onto, even if it's a small something, working on a new trail or thinking about how to connect parks, or if there's an issue that comes up, like we have found this concentration of crashes. It's a serious health issue, but what else is happening in that area, and can we all come together to address the problem, I think is how change really happens.
I would just add that I think Vision Zero was the first time we've really worked closely with our health department on an initiative, and I think it sort of, there's sort of a mindset, I think, generally in transportation that some level of traffic fatalities are inevitable, that there's user error, that somebody's going to get drunk and hit a tree, and I followed all the standards, I did my job. And Vision Zero really tries to turn that on its head. It's not trying to blame the engineer for the fatality, but trying to say that it's not an inevitable occurrence, that somebody has to die on the street, and that you don't need to wait for like 3 people in the last 5 years to die in order to do something in a specific location. So I think that we in the transportation side have a lot to learn from sort of an epidemiological approach to traffic safety and say what's causing people to die. Where can we predict where something bad is going to happen, more than just like, oh, I followed all the standards, so I limited my liability, and if they did something wrong, it was their fault. Like that's not going to get us to zero. And so when you start to say like, how do we really bring down these numbers, you find partners that can help you with doing that. So I think that's been really, really effective for us. I would love to see the same type of thing happen around active transportation. It hasn't really happened here in the district yet. And I think there's some opportunities, but it just hasn't been the place that we've come together. It's really been around safety so far.
Hi, I'm Things Amaro, member of the committee. So I wanted to ask you a question about the issues of land use, development, and equity. So these are big issues in the city planning office, for example, with lots of complex interest often involved between politicians, elected officials, developers, and then issues related to whatever community benefits. I'm particularly interested in whether I bring this up because the issue of land use is so huge in the issues of equity and segregation and displacement, etc. That often when low-income minority communities experience some development, it's often followed by displacement and etc. So actually the members don't get to benefit from that development. So, are there people thinking about models of doing development without at the same time resulting gentrification and displacement?
So I'll start. I'm sure Sam has some thoughts on this as well. It's a super complex question. I don't think anybody has an answer to it currently that I've heard of. And it is a very difficult thing to control because of the factors that you described, particularly when we have private interests, which come with a lot of capital and very highly valuable pieces of properties that are looked at, mostly for their profit. So one of the ways that it is addressed to some extent is through policies that hold particular numbers of units in housing as affordable, for example, or requiring across the city to have a certain number of units of affordable housing. But I think that that's where we're at, honestly. I think that those are kinds of the best answers that we have thus far. Because there's also there's upstream sort of tax laws that hold somebody's property at the same taxable level that it was at, in a certain year, so that if someone owns their house, they aren't paying such egregiously high taxes now that the land value and the house value has increased around them. So that's another way to do it, but it ends up being piecemeal, because it doesn't really have a community-wide impact. So it's a very important question that I would love to get a lot of really smart people working on.
I don't pretend to have all the answers to it too. I think one of the challenges, and we often, it's comes with development, it comes with bike lanes, it comes with new bus lines or things like that, is that investment shouldn't trigger displacement. And part of why I perceive that it has, I think people are right to perceive that it could, and that it has in the past, is that we haven't built enough places that people want to live that keep every place affordable in some ways, if that makes sense. So everybody wants to live in the district, or a lot of people do, because we've made a nice place, and because we've got parks, and we've got easy transportation access, and we've got hospitals, and we've addressed our food desert issues by having like a grocery store in every corner practically now. So a lot of people want to live here, and so any investment that makes it better to live here causes more people to want to live here. That doesn't mean we shouldn't make the investments that make it a good quality of life, but it also, so in some ways it means that like we've done such a crappy job of building suburbs. This is editorializing. We've done such a crappy job of building suburbs that people would rather not live there if they could choose not to, and so they've come back to cities. And this, I think, is true across the country. And so we need to make good suburbs, and we also, at the same time that we're making good cities, need to make investments in affordable housing and affordable living broadly that enable everybody to live in a location. And I think so. You know, you see even within a city, there's, I think, a lot of variation of desirability of different neighborhoods, and people's mindset of why they want to live in a certain place goes into a whole bunch of different. There's a whole bunch of different things that goes into people's minds. It's quality of school, it's quality of access to their jobs, it's quality of it's public safety. It's a whole bunch of different things that's very hard for professionals to sort of predict and to know what to do. So you sort of have to, in some ways focus on an individual community and try to reinforce the affordability that's there. And then in some ways spread some of that like peanut butter across the whole city so that every place has some level of affordability so you can enable everybody to choose to live where they want to live.
I'll just add one last comment that just came to mind as Sam was talking, which is it does call into question how we're measuring outcomes. Because if the populations are changing in the places that are developing in different ways, then it's really difficult to know who's being affected by what and if people are healthier or if it's just different people. So it's just something to think about when we're talking about this question.
So we have one final comment.
No, it's just a comment to follow on to that question, which is such an important issue. And just the juxtaposition of both of you sitting there together today, because some of the work that's been going on to try and investigate this is bringing in affordable housing at the same time in conjunction with transportation, since transportation is so important so that it doesn't end up increasing land values and then basically people have to move out. So if you can do them at the same time. So I just wanted to say it was great that both land use and transportation were represented for that.
And I would just say also on the housing side, I'm a transportation professional right now, but I've done housing stuff in the past. There's way more affordable housing out there right now than we will ever build. But we don't do anything to preserve it. So we've got all these expiring Section 8 contracts on housing, and we let them expire, even when they've gone from being undesirable locations to being desirable locations. And sort of a national or a regional or a local strategy on preserving the existing affordability will do a lot more than getting 10% out of every new housing development that gets built, because that's sort of not going to keep up, and the cost of building that new housing unit is a lot more than the embodied cost of the existing housing unit.
Well, I want to say thank you to our morning speakers. Give them all one more round of applause.